Yeah, so patients with polycythemia vera, like essential thrombocythemia, we focus on high-risk patients who are at the most risk for having a clotting event. The survival for patients with polycythemia vera, though, can be much shorter than those with essential thrombocythemia. So I think as opposed to ET, there's even more urgency for medications that could potentially improve survival in polycythemia vera. Of course, in ET and PV, that's going to be very difficult to show because patients do live a lot longer as compared to folks with, say, acute myeloid leukemia. On average, the lifespans are much longer, so it's going to be more difficult. But if we can identify really good surrogate markers of improved survival and then parlay that into new therapies that can extend that, I think that is the ultimate goal of what we're trying to do. I think in the short term, drugs that can better control hematocrits without a lot of side effects would be a welcomed addition to our armamentarium.